We have been participating in the NDNQI Nursing Satisfaction Survey for over the past 5 years. It's our way to really assess internally the overall satisfaction and job enjoyment of our nurses across our campus. And we're able then to compare ourselves to hundreds of hospitals across the nation to really see not only how we perform internally, but also how we compare to hospitals that are other academic medical centers and or other magnet facilities. And the reason that this is such good news for us this year is that we have each year surpassed our previous year's scores. And this year we have hit the highest scores we ever have. We are above the 75th percentile, which means that we are surpassing the scores of 75% or greater of the hospitals participating in this survey. And it really is a reflection, I think, of the nurses within our organization and the amount of commitment and motivation that they have to deliver upon our mission of serious medicine and extraordinary care. It looks at nurse-physician relationships. It looks at the ability and quality of nursing leadership. It looks at how well we do in engaging nursing in hospital and quality affairs, and their overall engagement scores. What it tells us is that nurses here not only care about the organization or engaged in the organization, but feel a very strong sense of ownership in this organization, which ultimately translate into nurses making some really great things happen here from a practice perspective, but more importantly from a patient care perspective. Our job as nursing leaders is almost to set up this environment and stay out of the way, because it's really these amazing individuals who do what they do on a day-to-day basis, and as the most trusted profession, it is our job as nursing leaders to really entrust them to deliver outstanding care to our patients. Individuals across the campus recognize that the majority of care delivery is through the hands of nurses, and therefore they've established a culture and an environment that allows our nurses to really function in such a way that they are able to do what they have been trained and educated to do. That is unique. You don't necessarily see that in other hospitals. And we've been able to take that culture and really build upon it. And I think our scores this past year reflect the fact that our nurses feel that they are working and practicing in an environment that allows them to be autonomous, that allows them to use independent thinking, that allows them to create the miracles every day that they do with regards to caring for patients and our families.
I definitely think it's a very positive environment here. It's really unlike anywhere else I've ever worked as far as the passion that I think people have for their jobs. I don't feel like anyone I work with, it's just a job. Everyone's really dedicated to what they're doing.
We're a very nurse-driven hospital. We've got a very strong voice in what we want to do, what we'd like to see, whether it's policy and procedure or just caring or for patients and increasing their satisfaction, patient satisfaction here at the hospital.
The administration, managers, leadership here are always open to listen to any of our ideas, our thoughts, or concerns.
We have the resources, we're being supported by the organization, and we feel that the idea of patient first isn't just verbiage, and that we're getting the support necessary to actually put the patient first. On our floor we saw that we felt patients needed to feel more involved in their care. They felt like they didn't have the control. Doctors and nurses and everyone's doing everything, and so we were able to implement goal setting, and it's just nurses recognizing these changes and having the means to be able to do it.
They also provide education, continuing education. We've got annual education. They're constantly wanting you to keep up with the changing times and the technology, so you're constantly learning new things.
We really have those resources available to us, and I think that it's showing in the satisfaction of all of us as nurses and the patient's outcomes.
One of the things about the Med Center is that we're a family. We're not just an organization, we're a team, and the whole organization institution feels that way, so it's really nice.
We've got a great crew of nurses. They provide excellent teamwork and help when you need it. They challenge you and encourage you.
Definitely just the environment of the coworkers and the culture that's here. It's definitely, in my experience, very unique.
It's a great teamwork. We have great attitudes. We have high expectations, and we live up to them.
Everyone I work with does have a high level of professionalism and just integrity. You know, there's a lot of autonomy in this job, and no one's watching over your shoulder all the time, but they have, you know, integrity to always be doing what's best for the patient.
I feel very lucky to be in the position I am and an ability to impact the patients and other staff members, and I enjoy it. And where else could I find a job that I enjoy?
We care for them like their own family, because that's how we were brought up. That's how we would like our families to be treated if they were ever hospitalized.
Not just a motto. It's something we do every day, thinking about what's going to be first for the patient, safety, what the patient needs. And if it requires us going and calling the same physicians over and over to get that done for the patient, that's what we're going to do. And for the families. We involve the family in the care that we're providing the patient and try to keep them as involved as possible throughout the whole process from admission to discharge.
It's kind of hard to imagine going anywhere else once you've had exposure to that environment.
I love what I do. I love working with the people and working with the patients. I came into this position because I care for people, and so I wouldn't do anything else.
The fact that we have exceeded the 75th percentile this past year is wonderful news, and certainly something that we are incredibly proud of. And I congratulate all of our nurses and our nursing leaders for really having delivered on such outstanding scores. But the work continues, and the work will always continue. From the perspective of, we know that we have opportunities, we know that we continue to learn and educate ourselves on best practices and creating even better environments for our nurses than what exists today. And so our goal is to exceed the 90th percentile here in short order. This is a place for nursing practice. And when we hear from our new graduate nurses or from nurses who have come from other institutions, they really reflect upon the fact that this is a wonderful institution that has allowed them to really do what they do best. And our nurses who have done amazing and outstanding things day in and day out from a patient care perspective really are the reflection of why we are able to do what we do and deliver upon our mission of serious medicine, extraordinary care.
I'm as happy as I could be. Yeah, wouldn't choose anything else.
It's just kind of a contagious, positive environment that makes you want to work that much harder because everyone else is.
Right here at the Nebraska Medical Center.